Hello, this is John Flutter here. Welcome back to the channel, Myofunctional Orthodontic Training. Dr Michael Mew, who is an orthodontist in England, has been asked to present himself to the General Dental Council. He's been asked to produce evidence to justify the claims he makes about treatment plans that he's been delivering to his patients in his practice for 20 years or more. And I want to look at some of the differences of opinion that are held by the orthodontic establishment and how those differ from the views and the practices proposed by Dr. Michael Mew. So before we talk about how we can produce the evidence, we really need to talk about evidence itself. And evidence comes in a pyramid form. That is to say, some evidence has much more value than other evidence. And the evidence that has least value generally is examples of clinical before and after cases. And even if you have some before and after cases and get a collection of before and after cases, that is really weak evidence. What is strong evidence is randomized controlled trials. And if you want to propose a particular treatment method and you need to have some sort of scientific backing to justify what you do, then really you need to have some random controlled trials, because in order to get the evidence-based clinical practice guidelines, in order to justify that, then you need to have this collection of evidence that's been analysed, and therefore you can make claims about the treatment. So if you want to have evidence to make your point, they're asking Dr. Mew for evidence, they're asking for these random controlled trials, and he doesn't have any. There are no random controlled trials. So one of the problems that Michael Mew has is that the evidence that he does have is not considered to be good evidence. On the other hand, Michael Mew might point to the scientific method, whereby having observed in the modern world that most children have got crooked teeth, most children in my working lifetime didn't have crooked teeth. Now they mostly do. There's an increase in pediatric sleep-related breathing problems. Ancient man didn't have crooked teeth. And if we go to less developed countries, we see large communities that don't have crooked teeth. Crooked teeth appears to follow the pattern of the industrial development. So having formed a basis that maybe there's something causing this, maybe it's the tongue posture that's causing this, he proposed a hypothesis or a premise that said tongue posture and lip posture is critical in cranial development. And then he tested the results by performing treatment plans and designing appliances to try and achieve his goals of lips together and tongue in the roof of the mouth. And then as a result of that, he felt he could justify the tropic premise and went on to make further predictions about sleep-related breathing disorders. Because the functional matrix theory is nothing new. Basically, the idea that bone is the master, is the slave, and that muscle is the master is nothing new. So if Michael Mew is saying that the jaws will develop as a result of the muscle pressures placed upon them, particularly the lips and the tongue, that seems to be quite a reasonable explanation. Whereas the orthodontist would say that whatever space there is within the mouth, that is where the tongue will go, not the other way around. Then what we need to look at is this whole question of these randomized controlled trials. Dr. David Sackett, who has proposed the idea of evidence-based medicine, came up with a different way of evaluating evidence. And so evidence based on model is not so much a double-blinded, randomized, controlled, placebo-mediated, peer-reviewed, meta-analyzed trial. It's rather evidence from different areas combining and trying to get a consensus between these views, like the skill and the knowledge of the expertise of the clinician is not taken into account on this pyramid of evidence. Patient expectation and satisfaction is not taken into account. It's interesting that there's not patients' complaints that have brought Dr. Mew before the General Dental Council. It's the British Orthodontic Society who reported him to the General Dental Council. So there's not patients' complaints. And the best appropriate evidence, research evidence, is important, but it's not the most important. It's not paramount. Evidence-based medicine should take into account of these other areas. And so if we're only considering evidence-based medicine based on randomized controlled trials, then it's clear that some of the evidence that Dr. Mew put forwards will not be accepted. Orthodontists do accept that children have their mouths open most of the time. And they will say it gets better as they get older. But they don't see or won't accept that there's no connection between that and cranial development because they cannot measure tongue posture. I mean, if you cannot measure tongue posture and if you cannot measure lip posture, then it's very difficult to show that what you're doing when you feel you change lip and tongue posture has an outcome, because you cannot show you've made the change. The argument is made that it is a result of normal growth and development. So whereas the tropic premise can explain different shapes of different arches depending on different muscle patterns, different breathing patterns and different swallowing patterns, although it can explain each and every one, each though it can be applied, and even though we can see children that have these muscle pattern deformities or have aberrant swallowing patterns, because we can't measure it, because we can't measure the improvement that we've achieved, then it's not determined to be proper evidence. But when we do make the changes of all of the other areas we work on and we don't make changes that can be measured, then it's discounted. Just as when we make changes that try and show maxillary growth, that's discounted because photographic evidence is not suitable for evidence. However many you've got, even if you've got people throughout the world that are doing treatment based on the tropic premise, and everywhere in the world they're getting similar results, if you cannot show and measure that it is tongue posture, then the idea that it is an unfortunate genetic event that's related to the malocclusion and randomized control trials showing that you can't change jaw size and make it stable means that it's the question of evidence that's really more important than the question of the actual scientific debate behind what we're talking about. Is it economic, environment and lifestyle, or is it genetics? We need to decide how we measure what we're going to look at when we make that decision. Let's follow this in other videos.